Yeah. Okay. This week's numerous news reports that expose the ever-worsening emergency medical services crisis is alarming. One thing I have learned since taking this seat in 2015 is that, as elected officials, our first and highest priority should always be to ensure we are providing quality public safety services for the people we serve. Let me start by clarifying that I'm extremely proud of all the Sedgwick County public safety professionals that skillfully work together to compassionately help our residents in that worst moment of their life. It is true there are attrition issues in many of the other Sedgwick County related facets, but today my focus is on EMS and the dangerous crisis that now exists. This predicament is not something that happened overnight, but something that has been developing for almost 3 years. Since October 2018, and especially since August of 2019, the EMS system has battled morale issues that has resulted in high levels of attrition and an overwhelming loss of institutional skill and experience. Before September 2018, the Sedgwick County EMS had proudly developed a national reputation and was revered as one of the very best EMS organizations in the nation, if not the very best. I have been told that Sedgwick County EMS is even referenced in paramedic curriculum as one of the best EMS systems in the nation. How did we get from that high reputation to today? Well, there's a lot I could say about that, but for now, I will just focus on a few points and the solution I believe that's needed. I think the Wichita Eagle's comprehensive reports should compel responsive leaders to act. Some people may discount those reports by saying that they are inaccurate or slanted. But from my personal knowledge on this situation, going back to the days before the former EMS director left Sedgwick County EMS, I believe the reports to be credible and factual. Note, from those reports, the Eagle reporters sifted through nearly 500,000 ambulance response times from Sedgwick County 911 and Sedgwick County EMS to determine how patients received care between 2017 and 2021. They compared detailed employee rosters. They analyzed more than 2,700 records pulled from county's marvelous software, which tells us where the ambulances are at any given moment, to calculate the ambulance shortage data. They've reviewed hundreds of emails, and they reviewed more than 10 hours of audio recordings between county officials and EMS employees in 2019, 2021, 911 audio, and they interviewed more than 50 people for their reporting. The investigative reporters that worked to develop those reports spent hundreds of hours over 3 months to investigate and organize the massive, complicated information into a series of news stories that effectively disclosed the reality of this crisis to the public we serve. We say we believe in transparency. On my organizational chart, it shows the citizens of Sedgwick County are collectively my boss. With that in mind, the people have an absolute right to know what is happening and why. I do not think the inevitable, necessary changes should be put off any longer. We have a plethora of data, and making some decisions to bring health back to the organization is already overdue, in my opinion. It's time to move forward. Although I appreciate the investigation being performed by Haidt and Fanning and Honeyman, they started this about 6 weeks ago. Those results, whenever they are presented to the commissioners, will be attorney-client privileged information and therefore not available to the public. Unfortunately, they did not interview the nearly 100 employees that have left Sedgwick County EMS since the previous permanent director retired in 2018. It seems to me that process should have included those folks. So what evidence do I have? Well, I have the EMS petition that was presented to the commissioners in June of 2019 that predicted where we would be today. I have the Board of EMS investigative report that I received in March of 2021. I have personally met and spoken with the majority of the staff across the EMS organization over the last 2 years. I listened intently to the roughly 4 hours of testimony when 39 EMS professionals, both former and current employees of Sedgwick County, bravely spoke up despite fears of retribution and retaliation. They testified in front of the county manager, Tom Stolzen, assistant county manager, Rusty Leeds. Most recently, we have numerous credible, comprehensive investigative reports from the Wichita Eagle that has exposed the situation to the public. And finally, we have seen a public support for change from the online petition that began about 2 days ago and already has about 3,000 signatures. I am disappointed that Sedgwick County leadership has allowed this issue to fester to the point that extensive organizational damage has brought the entire public safety system to the crisis, in my opinion. Let's be clear, the BOCC does not have the direct authority to make changes to organizational structure or leadership. If we had that authority, I would be glad to make those motions today. The one and only person that can make those changes and those decisions is the county manager. For example, on August the 20th, 2019, after a staff meeting with a discussion with BOCC, it appeared most of the commissioners were supportive of merging the EMS OMD organizations. So after that meeting, the county manager did merge the EMS OMD organizations and selected someone to lead the new organization. In my opinion, those decisions made that day are the main reasons we have an EMS crisis today. Since the BOCC cannot directly make the organizational changes or leadership decisions that fall under the authority of the county manager, then all I can do is share my opinion on what I think needs to happen. If changes to happen, it can only happen when the manager makes that decision. That can be today or next week or possibly never. So today I'm formally asking the county manager to make the necessary changes immediately. I firmly believe that we need to revert back to separate EMS OMD organizations because we know that worked well for decades, whereas this new model has not delivered any of the objectives stated for initiating this experiment. Secondly, we need to seek and place the best people to lead these separate organizations. I believe this is the action needed and will immediately stop the hemorrhaging and begin to restore the EMS system back to health. Thank you, Chairman.